Over half of all people today that are on Medicare are using Medicare Advantage plans. That's over 31 million people. Now, some of those people are really delighted with their Advantage plans. They like the zero premium to the insurance company and all the perks that are also offered. But some are not so delighted. In fact, they actually are seeing the disadvantages of the Advantage plan. In fact, they're very disappointed, and oftentimes they find their Advantage plan to be disastrous. And so not only are patients affected by Advantage plans and their flaws, but so are providers today. As Advantage plans have grown, providers are also seeing some of the disadvantages of taking those plans. And that's why we're seeing so many hospitals and doctors and other providers dropping Advantage plans. So in this video, I'm going to explain the problem and what the government's trying to do to fix it. Let's begin by addressing this question right here, and that is, who really wins with Advantage plans? We see tons of commercials. There's a tremendous amount of marketing that happens with Advantage plans. And why is that? Who is really the winner? Well, first off, it's the Medicare Advantage insurance companies. In fact, latest estimates say that there's at least about $60 billion of profit that insurance companies are making off of Advantage plans. This money, of course, funded by the government. And there's about 9 big players in the Advantage market, and there's a couple hundred small players. But again, $60 billion of profit that's available through these companies. So that is really the big winners. And so what the government is trying to do is they're trying to rein in some of the fraud and the waste and abuse that happens by these insurance companies. Let me just read a quick report to you. This just out, September of this year. The corporations that run Medicare Advantage plans are engaged in widespread waste, fraud, and abuse, resulting in tens of billions of dollars of overpayments to them every single year. The advocates and government agencies overseeing Medicare Advantage have spent nearly 2 decades reporting on this fraud, waste, and urging Congress to overhaul the program. Few in Congress or the administration were listening. Now the Biden administration has just finalized a rule, and I'll read a little bit from that rule here in just a few minutes. This rule that begins to rein in these overpayments, at last putting a spotlight on an issue that Congress and the public have long overlooked. The new rule is a small step towards reining in some of the overpayments to the Medicare Advantage plans and protecting the integrity of the Medicare Trust Fund, though it is not nearly enough. This article goes on to say the insurance industry's fierce opposition and the multi-million-dollar fear campaign the health insurance companies have recently launched against this proposed rule was their admission that Medicare Advantage plans can't provide coverage at a reasonable cost. Medicare Advantage only works, listen to this please, Medicare Advantage only works for the insurers if they are wildly overpaid and profiting exorbitantly. It was their admission that they cannot do what they were created to do, now some over 20 years ago, and are legally obligated to do. They cannot deliver Medicare coverage anywhere near as cost-effective as traditional Medicare, let alone at a lower cost as they had promised. The fight over small improvements to the flawed Medicare Advantage payment system reveals how challenging it is to fix Medicare Advantage and free it of the bad actors who are engaged in massive, sometimes fraudulent overbilling of Medicare. Medicare Advantage is in need of substantial overhaul, as the advocates, along with Medicare Payment Advisory Commission, the Government Accountability Office, and the Office of the Inspector General have all been saying for years. Here's the point. This is the real winner when it comes to Advantage plans. It's these companies that are making billions of dollars. Let's keep on going. The Biden administration final rule that I'll read some more about in this video as well, which includes good technical fixes to the payment model, but allows still tens of billions a year in overpayments to continue, is just a small step forward, and at the same time a tacit admission that the government cannot rid Medicare Advantage of the bad actors who are threatening Medicare's financial health. Without an overhaul, there's no stopping the bad actors. And so again, this is the big winner. Now, the second big winner will be the Medicare Advantage insurance agents. In fact, it is often, I hear reports back from our clients saying that the majority of agents that they talk to have only wanted to talk about Advantage plans. Well, I'll tell you why, because Advantage plan absolutely pays the agent a higher commission than that which we receive from a Medicare supplemental plan. And again, agents want to push those things that's going to pay them more. Now, the truth is sometimes Advantage is a good option, but many times it's pushed because the agent is concerned, first off, about their commission instead of the actual coverage and how that insurance is going to work for that client. In fact, part of this new rule came out because of the agents that are pushing the Advantage plans and not really taking care of the client's best interest. Let me read about the proposed rule. The proposed rule, and again, this is a 486-page rule that just came out this month, the month of November. It's part of a series of regulatory crackdowns on Medicare Advantage plans. Number one, their deceptive marketing practices. Number two, prior authorization delays. Number three, denials of care. And number four, narrow provider network limitations. And so why is it that agents push these? Here's why. The report goes on to say this: to stop Medicare Advantage agents from steering beneficiaries into plans that pay the agents the highest commission rather than the plan that best suits the patient's needs, the CMS proposed rule, they have a rule now that would limit the amount that agents can receive. In other words, they're saying these agents have to stop getting extra bonuses and extra commissions by pushing Advantage plans. It says here, currently, agents can receive far more than the current national commission cap. Said CMS explained that it has received complaints from state partners, consumer advocates, and some MA plans that agents and brokers receive add-ons and other financial incentives that are, likely to influence which MA plan an agent encourages a beneficiary to select during enrollment. For example, they say the agency said it has seen web-based ads that offer agents and brokers bonuses and perks such as golf parties and trips and extra cash in exchange for enrollments. So again, who's winning? Is the insurance companies and the agents. Now, there's also another player in this that wins, and that's this: those who can't afford Medicare A and B and a supplemental plan. Now, as I shoot this video in November of 2023, we're looking into 2024. The Medicare B premium is going to be $174.70 a month for most people. In order to have an Advantage plan, we have to be enrolled in A and B. And there's some people that even struggle with affording their B premium. In other words, they qualify for Medicaid or some type of other Medicare type savings program, so they have to have help just covering the Medicare Part B. And so for those people that can't even afford B, they certainly are not going to be able to afford a supplemental plan. Now, we're a nationwide brokerage company and we write all kinds of plans and represent a lot of different insurance companies. But right now, I would say on average, you're looking at an average G plan in the neighborhood of somewhere between about $125 to $150 a month. An N plan is going to be somewhere between $90 to maybe $110 a month. So if we get a G plan, we know that we're going to be out of pocket. Let's say that $125 a month, that's $1,500 a year. And there's some people that just simply cannot afford that. An N plan, they're going to spend maybe $1,200 a year. And again, they just simply cannot afford that. Now, the truth is, if they roll into an Advantage plan, they're going to pay as they go. If they get sick, they're going to spend a lot more than that premium anyways. But my point is, on a monthly budget basis, there are some people that just cannot afford that. Okay, and I really believe those are the people that win. We write Advantage plans. I'm not trying to bash Advantage plans because sometimes it really is a good fit. So I would say this is truly a legitimate winner, those who can afford it. And then fourthly, it's those who remain fairly healthy. In fact, we find the people that are delighted in their Advantage plan, they like the fact that there's zero premium to the insurance company, and most of them have really never had to use their insurance very much. They may have had to, have some doctor visits, specialist visits, and maybe even some other minor type things. But we find that as long as people remain fairly healthy, they tend to be fairly satisfied with their Advantage plan. All right. Now that could quickly change if they encounter some type of a serious health issue. Okay. So these are the people that win. Now I want to talk specifically about the providers. Why is it that some providers are dropping Advantage plans? Okay. And again, these are reports that you could readily find online if you do research as I do for my videos. But let's talk about why this is happening. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. This article is actually titled "Hospitals Are Dropping Medicare Advantage Plans Left and Right." And here's what they say. They say Medicare Advantage provides health coverage to more than half of the nation's seniors, but a growing number of hospitals and health systems nationwide are pushing back and dropping some or all contracts with the private plans altogether. Among the most commonly cited reasons for dropping the plans by providers are these: prior authorization denials and slow payments from the insurers. Okay, so what they're seeing is this prior authorization process, which gives the Medicare Advantage company the final say-so whether you're going to get a skilled nursing stay or a knee replacement or a hip replacement or an MRI or a CAT scan. All those kind of things end up having delays at times. And so providers are not happy with the fact that what a patient needs as far as care is concerned is now actually delayed by that insurance company. All right, and so that's one of the reasons. Some systems have noted that the Medicare Advantage carriers have faced allegations of billing fraud from the federal government and are being probed by lawmakers over their high denial rates. Okay, and so what we're seeing is this: slow payments from Advantage companies. And again, these hospitals and doctors, they want to be paid on time, but oftentimes that does not happen. One gentleman who is the president of a company called Scripps Health out of San Diego says this: it's become a game of delay, deny, and not pay. He says providers are going to have to get out of full risk capitation because it just doesn't work. We're, this healthcare provider, we're the bottom of the food chain, and the food chain is not being fed. In late September, this company, which is called Scripps, began notifying patients that it is terminating Medicare Advantage contracts for its integrated medical groups, a move that will affect more than 30,000 seniors in the region. It goes on to say, this gentleman, his name is Van Gorder, said the health system, their health system, is facing losses of $75 million from the Medicare Advantage contracts. I'm talking about just in 1 year, which will end December 31st for patients covered by United Healthcare, Anthem Blue Cross, Blue Shield of California, Centene's Health Network, which is a WellCare, and a few other smaller carriers. He goes on to say, if other organizations are experiencing what we are, it's going to be a short period of time before they start floundering or they get out of Medicare Advantage altogether. He says, I think we will see this trend continue and accelerate unless something changes. A group out of Bend, Oregon, called St. Charles Health System, took it a step further and was not only considering dropping all Medicare Advantage plans, but also encourages older patients not to enroll in the private plans during the upcoming enrollment period, which is going on right now, October 15th through December the 7th. The healthcare system's president, CEO, CFO, and chief clinical officer cited high rates, again, of denials of care, longer hospital stays, and overall administration burdens for clinicians. Ultimately, the health system has decided to remain in network with 4 of the MA plans and will not renew contracts for 3 of them. He goes on to say that we recognize changing insurance options may create a temporary burden for Central or people from Oregon who are currently on a Medicare Advantage plan, but we ultimately believe it is the right move for patients and for our health system to be sustainable into the future, to encourage patients to move away from Medicare Advantage plans as they currently exist. He says, I feel terrible for the patients in this situation. It's the last thing we wanted to do, but it's just not sustainable with these kinds of losses. Patients need to be aware of how this system works. Traditional Medicare, please listen to this, traditional Medicare, that's A and B with the supplemental plan, is not an issue. With these other models, seniors need to be wary and they need to be savvy buyers. So in other words, when they decide to get involved in an Advantage plan, they got to be wary and they're going to have to be savvy. And then they cite 13 more other instances where hospitals are dropping Medicare Advantage contracts. Let me just read through them real quickly. In October, the Nebraska Hospital Association issued a report detailing how Medicare Advantage is failing patients and jeopardizing Nebraska hospitals, 33% of which do not accept Medicare Advantage patients. One third report citing negative patient experience and post-acute delays. And so they're just having a lot of difficulties in that particular system. Plus, it says they're placing administrative and financial burdens on hospitals that accept Medicare Advantage patients. York-based, this would be in Pennsylvania, a company called WellSpan Health will no longer accept Humana Medicare Advantage and United Healthcare ARP Medicare Advantage plan starting January 1. Greenville, North Carolina, a health system called ECU, said it anticipates it will no longer be in network with Humana's Medicare Medicare Advantage Plans starting January 1st. Raleigh, North Carolina, a group based called Wake Med went out of network with Humana Medicare Advantage Plans in October. The plan provides coverage to about 175,000 retired state employees from North Carolina. They cited claim denial rate. Listen to this one. They cited claims denial rate that is 3 to 4 times higher with Humana compared to its other contracted MA plans. Zanesville, Ohio, a group there called Genesis Health System is dropping Anthem Blue Cross Blue Shield and Humana Medicare Advantage Plans in 2024. Brunswick in Georgia, Southeast Georgia Health System will terminate its contract with Centene's WellCare Medicare Advantage Plan on December 8th. Listen to what they said. The system said it started negotiations with the carrier after years of inappropriate payment claims and unreasonable denials. Nashville, Tennessee, Vanderbilt Health went out of network with Humana's HMO Medicare Advantage Plan in April. Fayetteville, North Carolina, a group called Cape Fear Valley Health dropped United Healthcare Medicare Advantage Plans in July. Another group out of Oregon, Corvallis, Oregon, called Samaritan Health, ended its commercial and Medicare Advantage contracts with United Healthcare. The 5-hospital nonprofit health system cited slow processing of requests and claims that have made it difficult to provide appropriate care to United Health's members, which will be out of network with Samaritan's hospitals on January 9th. Samaritan's physicians and provider services will be out of network on November 1, 2024. And again, these carriers try to go back and recontract, but this is the latest report on these. Just a couple more. Cameron, Missouri, stopped accepting Cigna Medicare Advantage Plans in 2023 and has decided to drop Aetna and Humana in 2024. Stillwater, Oklahoma, that medical center has ended all in-network contracts with Medicare Advantage Plan amid the financial challenges that they've been facing. The hospital said it made the decision after facing rising operating costs, and listen to this one, and a 22% prior authorization denial rate for Medicare Advantage plans compared to a 1% denial rate for traditional Medicare, of course, along with the supplemental plan. That's huge difference there. Okay, and that's the point. What we're seeing is a lot of post-acute placement delays. Someone needs to go to a skilled nursing facility, and that Advantage Plan has the final say-so because of pre-authorization, and again, those are being delayed. Just 2 more. Brookings, South Dakota, that health system will no longer be in network with nearly all Medicare Advantage plans in 2024. Last one, Louisville, Kentucky, that health system there, Baptist Health Medical Group, went out of network with Humana's Medicare Advantage plans in September. The system will also go out of network with United Healthcare and Centene's WellCare on January 1st without a new agreement in place. So you can see these are the issues. The last one I want to mention here is premature discharges, either from the hospital or especially from skilled nursing facilities. And that's a real problem today. In fact, let me just read just a quick note to you. I received this from a lady out of San Francisco, California. Here's what she said. Dear Marvin, I just want to thank you for all your Medicare YouTube presentations. They're professional, easy to understand, especially for seniors, and your sincerity is always shown through. You have taught me invaluable information of which I shall be forever grateful. Now listen to what she says. She says, I lost my husband in August of 2022 due to a premature discharge from a skilled nursing facility from a Medicare Advantage plan. He was 74 years old. And folks, this is what's happening today. There's so many times when it is not the docs, the providers that are making these decisions now. It is now the insurance company, and oftentimes their algorithms, as you'll see here in just a minute. So that's why providers are dropping this right and left. All right, let me conclude this by talking about why it is that some are going to lose with an Advantage plan. We saw there's some winners. We know the insurance company wins, the insurance agents wins. Those who do not have the money to afford a supplemental plan can win, and also those that remain fairly healthy. But there's absolutely some that are going to lose with their Advantage plan. Number one is going to be because of network problems. Anytime you're on an Advantage plan, you're going to either be in an HMO network or you're going to be in a PPO network. So let me explain just real quickly. Here's the way they have to work. When I say they, I'm meaning Advantage plans. They can control the cost of their plans by having networks. So what they will do is they will put together a network of providers, either an HMO or a PPO. Now, when you do your analysis and comparison, you're going to find that the HMO plans are always favorable financially, meaning lower copays, lower max out-of-pockets for the year, and usually some additional perks in the HMO plans. Why? Because they're trying to direct you to those plans, but there's a problem with that. Even though it looks better for you financially, essentially, now we're going to have a much smaller network than we would than if we had a PPO plan. And you're going to have a much, much smaller network than you would if you went with a supplemental plan, because supplemental plans do not have a network whatsoever. People who choose supplemental plans can go to any provider as long as the provider takes original Medicare. They will take the supplemental plan. But Advantage plans, it has to work through this network system. And so what happens with HMO plans, many times you have to have a referral to see a specialist. Now, some people are not irritated by that. Others hate that option. But again, that comes with HMO plans. Also, when you're on an HMO plan and you need to go out of your network to see, maybe get a second opinion or to see a certain oncologist or go to a hospital you'd like to get operated on, if they're not in the network, you can't go out. In other words, you are bound to stay in that network. Unless it's urgent care or an emergency situation, you have to stay within the providers of the network. And again, these provider networks begin to shrink when it comes to HMOs. Why is that? Because of what we just read about. Because that reimbursement rate to those providers is so much lower, and they just simply cannot function at those low reimbursement rates, plus the slow payment problem as well. Now, the PPO is going to have a larger network. They do not require that you see your primary to get an appointment with the specialist. In other words, no referral required. That's nice. But what happens, yes, you can go out of network on the PPO, but it costs you so much, most people are not going to do that. If I stay in my PPO network, my max out of pocket may be somewhere between $3,000 to $5,000 a year. If I go out, that could cost me $10,000 a year. And if I'm in my network here, a specialist visit may cost me $30, $50. If I go out, I got to pay 40% coinsurance. And so the whole point is, yes, I have the privilege, and we're glad you do, but it could cost you to do that. Some people just simply cannot afford those out-of-pocket costs if they happen to go out of their network. So that is one of the issues. That's the people who lose, who end up having some health problems, and now their networks are going to matter. If you have 1 or 2 doctors, probably not a big deal. But I can assure you, have 6 or 8 doctors, we may be very hard pressed to find a network that's going to take all your doctors. Therefore, some people actually have to change doctors. Hey, if you come to a place where you know you're going to have to make some Medicare decisions pretty soon, the best way to do that is to click up here in this right-hand corner, and you'll have an opportunity to be able to book a call with one of our Medicare guides. All the guides around here I have personally trained, and they truly are professional. They'll answer your questions, and they'll show you different Medicare options to make sure that you're confident in the decision that you make. Now, there's a second reason why people lose, and that's this, and that is the pre-authorization requirements. Now, I've talked about those, alluded to those, but I'm going to give you some specific details about what I mean by pre-authorization. This means that you need some kind of a healthcare service beyond a primary care doctor visit, beyond a specialist visit, beyond just basic labs. You need an MRI or a CAT scan. You need a hip replacement or a knee replacement. You need to go to a skilled nursing facility. Those kinds of things that are very expensive are going to have to be pre-approved by the insurance company, as we read in those reports. That's why a lot of providers are dropping these, because of the delays in pre-approvals or the flat denials that are going to happen. Let me just read this quick article to you. This is an article titled "Feds to Limit Predictive Tools for Medicare Advantage Plans." Let me say it again. Feds, the federal government, to limit predictive tools for Medicare Advantage plans. This comes from the Kaiser Family Foundation, their health news. This reported this year, October the 5th, 2023. Here's what they say. Several private insurance providers use a tool called NH Predict, which uses millions of medical records to match patients with similar diagnosis and characteristics. Based on the comparisons, the algorithm anticipates, listen to this, what kind of care a patient will need and for how long. Okay, so the computer system, the algorithm does this. Providers and patient advocates in several states told Kaiser they have noticed what they call a suspicious coincidence. The tool predicts a patient's discharge date, and their insurer cuts off coverage that day, even if the patient needs further treatment than that Medicare would cover. In other words, Medicare would allow that patient to stay there, but this algorithm, owned and controlled by the Medicare Advantage company, is making that decision to cut off that care, saying you should be fine to go home. That's really what happened with this lady that we just read about in San Francisco. The article goes on to say new federal rules for Medicare Advantage plans begin in January and will rein in the use of algorithms in coverage decisions. So here's my point. This is kind of the government's attempt to try to help the problem. But as I read this, you'll see I don't think they're going to get anything accomplished, or very little if they do. Here's what it says. Insurance companies using the tools, listen to this word, Those insurance companies using the tools are expected to ensure that they are making medical necessity determinations based on the circumstances of the specific individual, as opposed to using an algorithm or software that doesn't account for an individual's circumstances. So they're expected to stop using the algorithms. All right, well, the government can hardly even control the payments to Medicare Advantage plans, let alone these kind of situations. They're expected to do this. I doubt it. This goes on to say the tool must still follow Medicare coverage criteria, and they've always supposed to be doing that anyways, and cannot deny benefits that original Medicare covers. Herein, that's the problem. They've been doing it. If insurers, listen to this, if insurers believe the criteria is too vague, they can use their own criteria as long as they disclose the medical evidence supporting the algorithm. So there we go. They're not going to make any changes here because they can still set their own criteria, medical evidence to support the algorithm. Well, that's exactly what they're going to be doing. So again, that's a huge loophole. Let's keep going. Before denying coverage considered not medically necessary, coverage denial must be reviewed by a physician or other appropriate healthcare professionals with expertise in the field of medicine or healthcare that is appropriate for the service at issue. Again, someone gets denied coverage, and what happens? Now they're going to have to appeal that, and what they're going to say, there has to be someone else that's going to look at that, not just the algorithm. My question is, who is it that's paying these providers? They're going to look at that appeal. And the fact is, most people, when they get denied, they do not appeal. Okay, so that's the reality of it. So I doubt this is going to help much. I wish it would. I don't think it's going to. Then lastly, CMS Deputy Administrator and Director of the Medicare program said this to Kaiser, said that the agency will conduct, listen to this, audits to verify compliance with the new requirements and enforce action with monetary penalties or enrollment suspicion. The same thing they've been trying to do with Medicare for 20 years. And yeah, they make some audits, but again, it's going to be very difficult to weed out the bad actors that are abusing the system by having these kind of pre-authorization requirements. All right, just two more reasons why I believe some people are going to lose with Advantage plans. Then this would be what we call the annual MOOPs. MOOP is an acronym that stands for max out of pocket. So we have these MOOPs, and Advantage plans are required to establish a max out of pocket for that year. And most of them right now in the HMO plans are going to be somewhere in the neighborhood about $3,000 to about $5,000, which simply means that we pay co-payments for the majority of our services until we reach that max out of pocket for the year. And then you don't have to pay anything out of pocket. And then these max out of pockets reset every January. Right now, the PPOs across the country, I say they're averaging somewhere between about $4,000 and $7,000. And so my point is this. Whenever people have an illness and they, have cancer or some other kind of serious issue, they almost always max out. And remember what I said earlier. We set an in plan right now in the neighborhood of about $100 a month, a G plan about $125. And so if I had that in plan, I'm going to spend about $1,200 in premium. If I had that G plan, I'm going to spend about $1,500 in premium on an annual basis. And so when someone has a serious illness, they will spend far less money in their premiums and maybe a small deductible on their supplemental plan than they will if they hit that max out of pocket. And so who gets hurt are those people that hit the max, especially if they max out, they're being treated for something serious towards the end of the year, they max out, and then those max out of pockets reset every January, and then again, they're back to paying co-pays until they hit those limits. Okay, those are the people that are definitely going to lose. And then lastly, it's those people that can't switch their plan. So many people think today, because Medicare has this open enrollment season, we call it the annual election period, October 15th to December 7th. Many people think because we have this period of time, they can just switch and move plans very free, as though there's no rules for switching. And it couldn't be farther from the truth. Okay, there are rules for switching plans. In fact, if you live in New York, Connecticut, Maine, or Massachusetts, what I'm getting ready to teach does not apply to you. But if you live in 46 of the other states or in the District of Columbia, in order for you to get off of your Advantage plan and switch back to original Medicare A and B with the supplemental plan, you're going to have to medically qualify. So many people today will start with their Medicare Advantage plan, let's say maybe at 65 or 66, and their plan is usually to stay on the plan to maybe 70, 72 years old. And so they decide to stay on that plan. They've been on that plan maybe up until that age or some period of time, sometime over a year, they've been on the Advantage, and now they want to get off the Advantage plan. And again, unless you're in New York, Connecticut, Maine, or Massachusetts, now you're going to have to medically qualify to get that supplemental plan. Now, when you first went on Medicare, you would not have had to qualify because you have what's called the Medigap open enrollment period. And that Medigap open enrollment period is tied to the B date of your Medicare. It's the B date. So if I had a B date of 1/1/2024, I have 6 months where I can get any supplemental plan that's sold in my area, any company, any letter that you want. So that would be January, February, March, April, May, June. So that just simply means in this example, from July 1, 2024 on, unless you live in those 4 states I mentioned now, to get that supplemental plan, you're going to have to medically qualify. If you go on an Advantage plan when you first start that plan, if you stay on that any longer than a year, 2, 3, 4, 5 years down the road, to then get that supplemental plan, they don't have to take you. You're beyond that window of time. And now what are we going to have to do? Now we're going to have to go through underwriting. And that means that I'm going to have to ask you about 30 health questions. I'm going to have to check all your prescriptions to see what medications you're taking now or have the last 24 months. And I may have to get a statement from your doctor as to your general health or to explain certain medications that you're taking. But the point is, there's a process now involved that we have to go through called medical underwriting. We have to submit that medical information to the insurance company. And then underwriter does not have to take you because you're beyond that window. And now they can say, no, we're not going to give you that supplemental plan. And the reasons for denial are not necessarily life and death. If you're a diabetic that has retinopathy or neuropathy, you're not going to get to switch. You've lost your opportunity. If you have spinal stenosis, rheumatoid arthritis, any kind of cancer in the last 36 months. I mean, there's health issues that people have that the insurance companies say, we are not going to approve this policy. And then you can't switch that plan, and now you'll be on that Medicare Advantage plan for the rest of your life, having to live with networks, have to live with pre-authorizations, having to realize the insurance company has a final say-so and not your doctor, and so those issues will always be yours. And that's why I'm saying Advantage plans are a good fit for some people, but you have to make sure you know exactly how your insurance is going to work. And that's why we're seeing providers today who were excited about Advantage before, and now they're beginning to see some of the disadvantages of those plans, and they're dropping them. All right. And so I know these are really hard facts that I have to share with you today. And again, most agents don't talk about it. Why? Because agents are chasing a commission. But respectful, ethical agents are going to make sure that you knew both systems, you're aware of them, you know the cost of them, you know the ins and outs of those systems, because we know that when you make that decision, it could be the decision for the rest of your life.